Hello, my name is Tyler Fraum, and I'm an assistant professor of radiology with appointments in abdominal imaging and nuclear medicine at the Washington University School of Medicine in St. Louis, Missouri. I specialize in oncologic imaging with a focus on MRI and PET studies. First, I'd like to start with a point of clarification. The term radiation is often used imprecisely. For example, visible light is a form of radiation that causes no harm to our bodies. The type of radiation that we worry about in terms of health effects is called ionizing radiation. This is the type of radiation that, in large quantities, can damage the DNA in our bodies and potentially increase the risk of developing a cancer. For the remainder of this discussion, I will be using the term ionizing radiation. When people use the term radiation casually, this is the type of radiation that they generally mean. Although the very first imaging studies used ionizing radiation, giving rise to the name of the discipline of radiology, it is no longer the case that all imaging studies involve the use of ionizing radiation. For example, there is no ionizing radiation involved in an ultrasound or an MRI examination. That said, there are certainly several important imaging studies that still do use ionizing radiation. These studies include mammograms, radiographs, CT scans, nuclear medicine studies such as bone scans, and PET scans. These studies do result in ionizing radiation exposure to patients, though most imaging centers try to keep the amount of exposure as low as possible without making major sacrifices in image quality. Furthermore, most imaging facilities have ways of quantifying or measuring the amount of ionizing radiation a patient receives from an imaging study and tracking it over time. Before we embark on any further discussion, it is important to note that ionizing radiation associated with radiographs, mammograms, and CT scans differs from the ionizing radiation associated with nuclear medicine studies and PET scans. For radiographs, mammograms, and CT scans, the ionizing radiation source is located outside the patient's body within the scanner, and the radiation exposure comes from that radiation passing through the body as images are formed. In contrast, for a nuclear medicine study or PET scan, the ionizing radiation source is located inside the patient's body. Patients receive a radioactive molecule called a tracer, typically through an IV catheter in the arm. This tracer then circulates through the body. Images are formed as the ionizing radiation that the tracer produces exits the body and is detected by the scanner. As a result, ionizing radiation can continue to be emitted from the body for a limited period of time after the imaging study is over, potentially causing some exposure to others. This is not the case after patients undergo a radiograph, mammogram, or CT scan. After these studies, there is no potential for ionizing radiation exposure to others. Regarding imaging studies that do involve radiation exposure, there are several important points to note. First, ionizing radiation is something to which we are all exposed on a daily basis simply by living on the surface of the Earth. For example, radon is a naturally occurring radioactive gas that comes from soil and rocks and is present to small extents in the air we breathe, especially when indoors. The sun also emits ionizing radiation that reaches the Earth along with sunlight. The average amount of ionizing radiation from these natural sources to which someone living in the United States is exposed each year is a useful reference when thinking about the ionizing radiation exposure in medical imaging. I recommend the website radiologyinfo.org as a reference on this topic. For example, a PET CT scan is the equivalent to roughly 3 years of ionizing radiation exposure from natural sources. There is good evidence that exposure to amounts of ionizing radiation greater than what we get from natural sources over 30 years may increase the risk of cancer by several percentage points. However, whether there is a risk from smaller amounts of ionizing radiation, such as the amount to which you might be exposed during a medical imaging study, is less clear. If there is a risk, it is probably a small fraction of 1%. The risk to family members from being around you after a nuclear medicine study or a PET scan is even smaller. For example, if a family member spends about 2 hours with you around the time of a PET scan, the amount of ionizing radiation exposure to that person would be roughly equivalent to just 2 weeks of radiation exposure from natural sources. Second, a discussion of the risks of ionizing radiation exposure must also consider the benefits of the imaging study itself. In the vast majority of cases, the benefit of gaining information about your cancer status from the imaging study, such as staging your cancer or assessing its response to treatment, and the effect that this information can have on choosing the optimal cancer therapy will far outweigh the small risks of ionizing radiation exposure from your examination.